Hey everyone, this is Carrie and hope you're all doing well. In today's video, I'll talk about what are the risk factors for diabetes. So if you like the video related to my health, my way, I would like to request you all, please do subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. So, risk factors for type 1 diabetes are not as well understood as those for type 2 diabetes. Family history is a known risk factor for type 1 diabetes. Other risk factors can include having certain infections or disease of the pancreas. So, risk factors for type 2 diabetes and pre-diabetes are many. The following can raise your risk of developing type 2 diabetes. So, being obese or overweight, high blood pressure, elevated level of triglycerides and low level of good cholesterol, sedentary lifestyle, family history, increasing age, polycystic ovary syndrome, impaired glucose tolerance, insulin resistance, gestational diabetes during a pregnancy. So, ethnic background, which is Hispanic and Latino Americans, African Americans, Native Americans, Asian Americans, Pacific Islanders, and Alaska natives are at greater risk. Now, the question comes, what are the different types of diabetes? So, there are two major types of diabetes called type 1 and type 2. Type 1 diabetes was also formerly called insulin dependent diabetes mellitus or juvenile onset diabetes mellitus. In type 1 diabetes, the pancreas undergoes an autoimmune attack by the body itself and is rendered incapable of making insulin. Abnormal antibodies have been found in the majority of patients with type 1 diabetes. Antibodies are proteins in the blood that are part of the body immune system. The patient with type 1 diabetes must rely on insulin medication for survival. Now, the question is, what is type 1 diabetes? In autoimmune disease such as type 1 diabetes, the immune system mistakenly manufactures antibodies and inflammatory cells that are directed against and cause damage to patient own body tissues. In person with type 1 diabetes, the beta cells of the pancreas, which are responsible for insulin production, are attacked by the misdirected immune system. It is believed that the tendency to develop abnormal antibodies in type 1 diabetes is in part genetically inherited, through the details are not fully understood. So the exposure to certain viral infection, mumps and Coxsackie viruses or other environmental toxins may serve to trigger abnormal antibody response that cause damage to the pancreas cell where insulin is made. Some of the antibodies seen in type 1 diabetes include anti-islet cell antibodies, anti-insulin antibodies, and anti-glutamic decarboxylase antibodies. These antibodies can be detected in the majority of patients and may help determine which individuals are at risk for developing type 1 diabetes. Now, what is type 2 diabetes? Type 2 diabetes was also previously referred to in non-insulin dependent diabetes mellitus or adult onset diabetes mellitus. So, in type 2 diabetes, patient can still produce insulin but do so relatively inadequately for their body's need, particularly in the face of insulin resistance as discussed above. In many cases, this actually remains the pancreas produces larger than normal quantities of insulin. A major feature of type 2 diabetes is a lack of sensitivity to insulin by the cell of the body. So, in addition to the problem with an increase in insulin resistance, the release of insulin by the pancreas may also be defective and suboptimal. So, in fact, there is a known steady decline in beta cell production of insulin type 2 diabetes that contribute to worsening glucose control. This is a major factor for many patients with type 2 diabetes who ultimately require insulin therapy. Finally, the liver in these patients continue to produce glucose through a process called gluconeogenesis. Despite elevated glucose level, the control of glucogenesis become compromised. So that's all about the diabetes in this video. And one thing more I need to clear mention here, I just prepared a small presentation for all of you guys that will be going to share in the description box below. You can check it out from there, and I'm 100% sure about it that will be going to help in order to overcome your diabetes. So that's all. Before signing off, I would like to request you all, please do like, share, subscribe this video with the loved ones so that they can also gain their knowledge about this. So we'll definitely meet you in the next video. Till then, God bless you all. Bye bye, take care.